So, if you're watching this video, it's likely that either you or a loved one is sick of having constant itchy skin. You have eczema and you don't know what to do about it. I want you to keep watching because today you're going to learn something that will hopefully take this away. In this video, you're going to learn about things that you can do both at your doctor's office and more importantly, what you can do at home to treat this. Also, make sure you stick around to the end because we're going to give you a bonus tip on how you can save money on your health care. All this and more coming up. Welcome to Family Med, your medical home for practical and accurate information to help your family make healthy decisions. I'm Dr. Eric Richardson, and today we're tackling part 2 of our series on eczema. If you haven't seen the first one, then definitely check it out. In that video, we talked a little bit more about what eczema really is, and most importantly, some great steps you can take to prevent your eczema from flaring. In this one, we're going to focus on treatment. When you have eczema, inevitably, there are going to be times that you or your child will get a flare. So what are you going to do about it? First of all, you're going to continue doing all the preventative measures that we talked about in the first video. You're going to continue to care for your skin. Next step in treatment is really going to depend on how bad your flare is. For more significant flares, you're likely going to need the help of your physician. I'm not going to go too in-depth with available prescription medications, as that is something you can decide on with your doctor and discuss with them.
But common treatments will include various steroid creams. You may hear the names such as triamcinolone, betamethasone, albendazole. These all act to help cut down on the inflammation of the skin and help it heal. Now there are some non-steroid creams containing drugs, they're called calcineurin inhibitors. Okay, big word I know, but it says these medications, well, they have trade names such as Protopic or Elidel. What they do is they help decrease your body's overactive immune response that is happening in eczema. There's also a new one called Eucrisa, okay, that's used kind of for the same. These medications are designed for more long-term use because the problem with long-term use of steroids is they can actually affect the skin, including causing skin changes and thinning of the skin. So that's why it's important to work on prevention so you don't have to use those as much. So what are some things that have been studied that you can do at home that can be helpful? Okay, one simple thing that's available to you is just hydrocortisone cream. Okay, this usually comes in like a 1% strength over the counter. It's easy to apply and does well to help on those early stages. It's not going to be strong enough for a really bad flare, but if there's a mild area or one that is starting, it's certainly worth a try. Okay, so there's also an ingredient possibly most of you have never heard of called cardiospermum. It's a flowering tropical vine native to Indian Africa. When extracted and put into a topical ointment, this cardiospermum can actually help reduce inflammation, itch, and bacteria on the skin. There are some commercially available products that have this in them, but they can be a more natural steroid alternative. I'll put an example of this in the links below. Another one that can be helpful is actually sunflower oil. A few small studies have looked at sunflower oil and have found some benefit of its application in eczema. It's been shown to help with bolstering the protective fats in skin called ceramide and has some anti-inflammatory properties. Applying a light weight oil on the skin after bathing or mixing it with some sort of a lotion can be helpful for some. So how about coconut oil? One study showed that application of coconut oil helped decrease the burden of bacteria in the skin of those with eczema and has been used quite a bit actually in help treating inflamed skin. So mixing some oil with a good lotion can also benefit some. So here's one that's interesting, massage. We know that stress can be a trigger for eczema. They've actually looked at massage and helping with the treatment and prevention of flares. The studies done were very small, but did show actually some measurable improvement in those where massage was incorporated into their treatment. So, next one is vitamin D. One study showed that those taking 1,000 units daily showed some improvement in their eczema. This is a small study, so definitive improvement really can't be proven. However, it's something interesting to think about. Talk to your doctor about their thoughts on the safety of supplementation in your case. At last, we're going to talk about probiotics. Now, probiotics are a topic that has had a lot of press and a lot of excitement regarding its potential in helping with prevention or treatment of eczema. Probiotics are the healthy bacteria that you can take that are good for you and support a lot of your body's functions. They're found in foods such as yogurts and other fermented foods, as well as in various different supplements. Some initial studies were done that showed actually some significant promise. One study in 2001 showed that when women who were pregnant and then their babies were given lactobacillus probiotic, it cut the development of atopic dermatitis in half. Unfortunately, the follow-on studies weren't quite as promising. A study in 2005 showed that giving probiotics to older children with established eczema helped them get better. But again, the follow-on studies weren't quite as good. So there is some thought that probiotics can help, but what strain of bacteria, how much to give, really aren't known. It isn't going to hurt you, so maybe something you want to consider or talk through with your doctor. As always, if you're trying these things on your own and they aren't working, make sure that you consult with your doctor and take on the next steps you can take. This is a treatable condition, so the quicker you can get on top of it, the better off you'll do. So there you have it. Hopefully you have some good, useful information to help you in your battle with eczema. Remember, check out the notes below to review some of the highlights. And go ahead and comment below as well. What have you done to treat eczema? Are there things that you have found useful that we haven't discussed yet? There's certainly a lot of things out there that can be helpful, so let us know what you think. I've also attached some links and some other products you might find useful, so go check them out. Okay, now don't forget to like, subscribe, and share this video with your friends, and take some time to check out the other videos on this channel. Okay, now I always have to say this. Remember, my purpose in sharing this information, is to educate you in things that you can think about in trying to make decisions in your own health. In no way should this be taken as direct medical advice to you in your own situation. So please consult your own doctor for concerns regarding your specific situation. So until next time, this is Family Med with Dr. Eric Richardson. Remember, please take care of your body because it's the only one you have.
Congratulations to those who have stayed till the end of this video, because you've made it to the bonus tip of the day. So here it is. I hear all the time about how expensive healthcare is. I can't deny this. But if you learn to work the system right, then there are definitely ways that you can avoid spending so much. Today's tip may seem obvious, but it can result in a significant savings. When you need care after hours, try and go to an urgent care center instead of going to the emergency room. This can result in thousands of dollars in savings. Now, I'm not going to tell you when it's appropriate or not to go to the ER. I don't know your situation. What I'm going to say, though, is that much of the time, the issues seen in the emergency room can easily be handled in an urgent care setting. I'm not talking about your heart attacks or respiratory distress. I'm talking about the late night visits for cold or earache symptoms that tend to plug up the emergency room. If you wonder where is most appropriate to go in your situation, call your doctor's office. There's always somebody that's on call that can help guide your decision. A lot of the time, things can wait until the next day, so take advantage of whoever's on call and get their advice on the best place to go. If you don't have a doctor, get one. If you still don't have one, then a lot of insurance companies have nurse triage lines that you can call and get advice as well. Going to the ER instead of urgent care for an unnecessary visit can cost you thousands of dollars more that you really didn't need to spend.